Kogi State Governor Ahmed Usman Ododo has commissioned 80 primary healthcare centers promised to provide more qualitative health services in Kogi State. The governor, who officially commissioned the PHC centers in Lokoja, the state capital, pledged to provide more PHC centers in the state. Governor Ododo commended Ogori-Magongo local government area for the outstanding delivery and emergence as the best performing PHC centers in the just concluded Integrated Measles-Rubella, Polio, HPV routine immunization. He backed up the award and recognition with cash prize of millions of Naira to support the LGA health centers and individuals who were recognized. Our reporter Faith Adike has more.
The Kogi State Ministry of Health, in collaboration with the National and State Primary Healthcare Development Agency and the World Bank Impact Project, has commissioned the first phase of 80 revitalized primary healthcare centers across the state.
What is happening here is not only in Kogi, it's happening across the 36 states of this country, including FCTs. I know you have promised that you will not allow any of our primary healthcare centers to run short of drugs and other necessary equipment. I trust you for that, and I want to assure you as a government, we will do our own too. As the chief servant of this state, I call this state to the glory of God Almighty and service to humanity, which of course is our people here.
During the commissioning ceremony, Governor Ahmed Usman Ododo described the event as a celebration of the state's remarkable progress in health delivery and a testimony to his administration's commitment to improving the well-being of citizens.
In our collective journey towards a stronger and healthier Kogi State, today's gathering marks another milestone in our administration commitment to providing accessible, affordable, equitable, and quality health care for all Kogites. The presentation of the State Leadership Challenge Award, they symbolize our vision of building a sustainable and people-centered healthcare system that serves every community across the 239 wards of the 21 local governments of our dear state.
According to the governor, the revitalization of 80 primary health care under the World Bank Impact Project and the National Primary Healthcare Development Agency marks a major milestone for Kogi citizens. He noted that the newly upgraded facilities will serve as a model of excellence, enhancing grassroots access to quality health care services. Governor Ododo expressed appreciation to President Bola Ahmed Tinubu for his visionary leadership and unwavering commitment to transforming Nigeria's health sector. He also commended Dr. Moi Aino, Executive Director and the Chief Executive Officer of the NPHCDA, for his dedication and partnership in ensuring improved healthcare delivery across the country.
Permit me to first of all appreciate our father, a leader, His Excellency President Bola Ahmed Tinubu, GCFR, for his steadfast dedication to the transformation of the health sector in Nigeria. Dr. Aina is not only a distinguished Nigerian, but also an illustrious son of Kogi State, a visionary reformer whose passion for innovation is helping to build game-changing platforms that delivers excellent results. We are proud of his remarkable leadership and grateful for his commitment to supporting development of healthcare in his hometown. Regardless of your location, has access to functional and well-equipped health facilities. We recognize that the government alone cannot meet all the needs of the people. That is why we continue to value the contribution of our partners who tirelessly support the growth and development of our healthcare system. To all our development partners and supporting agencies, we are saying thank you for standing with and by us at all times.
The governor officially launched the distribution of vital medical equipment and commodities to primary health care centers across the state to ensure timely and efficient healthcare services, particularly in rural communities.
Part of it, we're donating medical commodities, reproductive health commodities, medical equipment that will go around all of the local governments in this, some of the facilities in the local governments in this state, to the glory of God and to the benefit of all Kogans.
The collaborative effort between the state, national agencies and development partners also saw the recognition of outstanding performance, local government areas and individuals who excelled during the last Integrated Measles-Rubella, Polio, HPV and routine immunization campaigns. Awardees received the State Leadership Challenge Award with cash prizes presented by the governor.
Award second best in primary health care, Kogi West Senatorial District. Second position goes to Kogi local government.
And the first position in primary health care in the Kogi Central Senatorial District goes to which local government? Who can guess? Ogori local government.
Congratulations.
Governor Ododo congratulated the recipients for their outstanding contribution to the healthcare delivery, describing the awards as both a reward for excellence and a motivation for others to emulate. He, however, cautioned against vandalism and misuse of public health facilities, urging communities to take ownership and safeguard the infrastructures provided for their benefits.
The overall best is, well, Ogori-Magongo.
It's my turn to beat, baby.
Those individuals with outstanding performance in primary health care service delivery as a government and as somebody, okay, I think there will be another award today because somebody laid this foundation some time ago. If you attend to people, you are in the hospital 24/7 to do your work diligently. Even if you don't reward you, God will reward you. Those individuals that have performed outstandingly, we are going to, just a token, for them to know that we appreciate them, we value them, and we want them to do, and we want others to join them. We are going to award them with a token of 250,000 Naira each. Secondly, first position in each senatorial district, 3 million each. Second position in each senatorial district, 2 million. So the overall best local government in strengthening PHC in Kogi State, 5 million.
Governor Ododo further commended the Commissioner for Health, Dr. Abdulaziz Adaiza, and the Executive Director of the State Primary Health Care Development Agency, Dr. Musa Meza, for their dedication and outstanding results, noting that their efforts have continued to make Kogi State proud. In their separate remarks, Commissioner for Health Dr. Abdulaziz Adaiza and Executive Director of Kogi State Primary Health Care Agency Musa Omeiza expressed gratitude to Governor Ahmed Usman Ododo for providing a conducive environment and the necessary support to operate efficiently across the state.
The story of Kogi State through the monumental achievement in health sector under our dynamic, health-friendly and committed leadership of His Excellency Alhaji Ahmed Usman Ododo, popularly called the Chief Servant of the State, will be told for generations to come. These glaring evidences of performance cannot be hidden. Yet again, we're gathered here today to showcase to the world what leadership in humility, selfless service, commitment, and dedication to human development means. The Chief Servant and his administration, anything to better the life of his people is not taken for granted. Health is paramount, and His Excellency leads to prove that. The effort of the state to change the status of our primary healthcare centers, which were in dire need of attention, has been complemented with the support of World Bank through the Impact Project, the National Primary Healthcare Development Agency, and development partners.
Many thanks and support to World Bank through Impact and National Primary Care Development Agency for making this possible. This facility now have staff that can stay for 24 hours. And by the grace of God, maternal, infant, and child mortality rate will be brought down to the barest minimum. And with the effort of the federal and state government, ensuring the care that is needed, we are going to make sure that these centers are made habitable and very conducive.
The Executive Director of NPHCDA, Dr. Moeed Aino, also commended the governor's leadership and commitment to quality healthcare delivery, reaffirming the agency's continuous support for the state's health initiative.
I've come here a few times, and each time there's always a stakeholder engagement as part of your activities. That is leadership. You want people to speak. You want to hear your people speak. You also want them to hear from you and engage with you and touch you and greet you. Your Excellency, that is leadership. Please keep it up. We are very thankful. An example that I will give, of a recent demonstration of your commitment to health. I'm not going to repeat all that has been said about all the PHCs that you are revitalizing. By the way, they're very beautiful. I like the standardization of the colors, and that's something I'm going to tell other states to come and. I also see, and we're all aware of the effort you have also made to increase insurance coverage in the states to provide financial protection for the vulnerable. Thank you, Your Excellency. We have worked with His Excellency to provide equipment for vaccine storage. We also have essential medicines. We heard what our brothers and sisters said. The infrastructure, the buildings, the equipment are good. The staff that are there are good, but they also need the commodities for them. So we are providing a little bit in addition to what His Excellency is already doing.
He encouraged community leaders and health workers to intensify vaccination campaign and sensitize mothers on the importance of immunizing their children. Religious leaders and local government chairmen who spoke at the event appreciated the governor for his huge investment in the health sector, which they described as timely and impactful.
Your Excellency, on behalf of traditional institution, again, we have to say thank you. You have engaged the traditional rulers not to be sleeping in their restroom any longer. The healthcare, all 239 wards are being equipped with facilities that will stop them from not coming to Lokoja, the headquarters, or the local government headquarters. Your Excellency, and we are here again for another distribution. May God continue to bless your government, your cabinet, and everyone that believe and trust in your governance.
We also want to thank the Executive Director, Dr. Muyi, who has been preaching to us on how primary health sector can be developed in Kogi State. So we appreciate you and thank you for believing in our government, because you always make sure that you are preaching good news about His Excellency. God be with you.
The Ogori-Magongo local government area emerged as one of the shining example of excellence, and its chairman received 2 awards for the best overall performance, along with a cash gift of 5 million naira to support the local government health centers. It's a decade reporting for MSC TV.